Hi friends, I am Dr. Toishi Sharma and today let's talk about a common question that my patients ask me. Can you have a heart attack even if your ECG is normal? So friends, the short answer is yes, you can have a heart attack even if there are no significant findings on the EKG. Let's understand how. So when we talk about a heart attack, there are two major types of heart attack. The number one is called STEMI or ST elevation myocardial infarction. The ST elevation refers to a segment on the ECG finding which is elevated, and this usually means that a blood vessel is acutely 100% occluded. We consider this type of ECG finding an emergency and usually try to open the blood vessel in less than 90 minutes. If someone has an ST elevation MI or STEMI, then whether it's 1 a.m. or 4 a.m., the whole cath lab team goes to the hospital and tries to get that artery open, because this particular finding on the ECG most of the time indicates that there is 100% blockage, and so we want to save the muscle as soon as possible. Now let's talk about a second type of heart attack, which is called non-ST elevation MI. As the name suggests, there is no ST elevation seen on the EKG. Instead of this finding, there may or may not be additional findings on the ECG. For example, someone having a heart attack can have ST depressions, or they can have a finding that we call T-wave inversions on the ECG. Although these can suggest a heart attack, many times we find that the ECG can be completely normal, but the patient has symptoms like chest pain or shortness of breath that are acute in onset, and at the same time a blood test called troponin will be positive. So even if the EKG is normal, but the blood test shows that your troponin is positive, along with that you have symptoms, then that still counts as non-ST elevation MI. We do not find these ischemic changes like ST depressions or T-wave inversions in every single patient that has an MI or myocardial infarction. So friends, to answer your question, it is not necessary to have acute EKG changes. The other reason is that EKG is a snapshot in time. Person having a heart attack may have dynamic EKG changes, which means that the changes come and go. So if we are not continuously getting an EKG, we are going to miss some of the changes. And that's another reason why someone can have a heart attack even if their EKG is normal. Now friends, let's talk about one more possibility. If someone is having acute onset chest pain, but their blood test is normal, and if they have EKG changes, then that is something called unstable angina. Meaning, out of the three things, you have the symptoms, you have the EKG changes, but your blood test is negative. We treat it almost as urgently as a non-STEMI, because we think that there is a plaque that is threatening to rupture and can cause a heart attack. So we also club the non-STEMI and the unstable anginas together. So friends, that is the reason if you are having acute onset chest pain or shortness of breath, then you should not delay your evaluation and you should seek urgent evaluation in the emergency department with a full history, physical examination, EKG, as well as blood testing. That will be very important in figuring out the next steps for you. I hope this video was helpful, and if you have any cardiology related questions for me, please feel free to comment. Thank you.